My name is Maggie Harvey. I'm lived in Arizona for the past 35 years. I moved here from New Jersey. I have a husband, Bill. I have 2 children, and I have 7 grandchildren. I've lived here in Sun City West for about 8 years, and fortunate enough to be employed here as an event planner. In 2011, I woke one night in the middle of the night with some chest pain, with some jaw pain. I was taken to the hospital and was first diagnosed with anxiety, which was odd to me because it was in the middle of the night and I didn't know what would have set it off, and I had never had an anxiety attack before. 2 days later, I woke up in the middle of the night, same sensation again, went to the hospital, and I was diagnosed with pneumonia. And they found a spot on my lung, and they weren't overly alarmed, but eventually came with the diagnosis that I had valley fever. Several months had passed. I still wasn't getting any better. I was still having this sensation. I still wasn't feeling well. I was fatigued. My husband said, you know, I think you need to make an appointment at Mayo Hospital just to make sure that we're on the right track. We made an appointment at Mayo. We went to see Dr. Wingasson. She's an internist, and we did a workup with her, and she wanted me to see Dr. Parrish, who is a lung specialist. And so a week or so passed. Went to see Dr. Parrish. He wanted me to have a few more tests. He really never told me what he was suspecting, and then he did call and say he wanted me to go for a biopsy. We made arrangements for the biopsy. I went there and still didn't really know what we were looking for. I thought we were still on the valley fever track, and it was a few days after I had the biopsy. That they said I had cancer. They said I had lung cancer. It was a slow-growing cancer, and that I was a stage 2, not quite a stage 3. So it was quite the shock. It was the last thing that I had expected. I was always very, very healthy and very, very active. Longevity does not run in my family. Both parents died with heart disease, so my thought was that I was in good shape. I worked out, I ate right. I was a former smoker, but I had quit about 25, 30 years prior to this happening, so I never even thought about the smoking being an issue. As it turned out, the oncologist said that the type of cancer that I had was typical of a non-smoker's cancer. So that made me feel better because I thought, well, I did do all the right things. I met Dr. Ross, who's my oncologist, just love her, and Lindsay Allen, just love her, and told me that I would be seeing Dr. Jaruzelski. And the hardest thing for me about seeing Dr. Jaruzelski was learning how to say her name until I was told to say Dr. JZ, and it made it a whole lot easier. But the one thing I do remember about the first time I met my surgeon was when they made the introduction, the nurse came in and was taking all the information, and she said, "I'm so sorry to have met you." And it was pretty, I didn't want to meet her either. But I met Dr. Jaruzelski. She said she had met with Dr. Ross, and they had discussed it, and they were going to proceed with surgery. They wanted to remove my right upper lobe. I had the surgery. Dr. Jaruzelski said she was going to try and do it as laparoscopically, so she wouldn't be as invasive. And she was going to try, and she did. She did it that way, and kept me comfortable the whole time. I think I was up probably the next morning walking around, which kind of surprised me and my family. A few weeks after that, I started chemotherapy. That was a little bit of a disappointment because we were hoping that I didn't have to have chemo, or I'd be eligible for a trial where I could have oral medication. And Dr. Ross decided that it was best that I have chemotherapy. So I had one round of chemo, which was 6 sessions, and it wasn't so terrible. It wasn't so great, but it wasn't so terrible. And to be honest with you, I said to my husband, I don't care, it doesn't matter. I don't care how sick I get, I don't care how tired I get. As long as we get rid of this, and I get the end result, that's all that mattered. And so we got through it. Everybody at Mayo was very, very nice. We got through that part of it. And you know, you get through the chemo, and I kind of felt lost because I wasn't going to Mayo anymore for another 3 months. I was on 3-month maintenance. And just recently, Dr. Ross put me on a 6-month maintenance, so that was another milestone for us. But you know, after the chemo, it took me a few weeks, maybe a few months to get back on my feet, get some of my strength back. I never really quit work. I worked part-time or full-time. You know, some weeks were better than others. Fortunately, I had a job that everybody was very understanding and allowed me to do that. But you know, it was like all of a sudden I woke up, you know, my husband used to tease me and I'd say, I love you, or you're very cute, and he'd say, oh, Maggie, you're a very sick woman, and I'd say, yes, I am. And but then all of a sudden, he said that one day, he said, no, not anymore. And it was just that one day I hit, and I thought, well, it's behind me. I'm now a survivor, and I can move on. And it was just about, and I think that took probably about a year to get to that point, from beginning of having the surgery until the diagnosis, and then reaching the point of feeling not sick anymore. We just tried to think positive through the whole thing, and I think we did a good job getting through it.